Welcome back to CT Buzz. Well, when it comes to our digestive system, we may overlook the warning signs on when something might be wrong. We are joined live right now by Dr. Hussein Wazaz. He's going to tell us exactly what signs to look out for. Dr. Wazaz, welcome back.
Thank you, Natasha.
And this is something that you really are passionate about educating people on, because these warning signs should be taken very seriously.
Yeah, I mean, it's one of the most common things to have some GI upset, or my stomach doesn't feel good, but certain symptoms require immediate attention, and we're trying to highlight 3 symptoms. One has to do with the upper GI tract, which is the stomach and the esophagus. The other was with the pancreas and the liver, and the third one will be with the lower GI tract or the colon. So number one, if you have a hard time swallowing or it's painful to swallow, that's a sign that's concerning. So you need to see a doctor. And I say you have to see a GI doctor, because all the time you go to the ER, you go to the primary care, and sometimes it's not very helpful. Again, most of the time it's not serious, but sometimes it's serious because it can be a sign of damage of the esophagus tissue or a narrowing in the esophagus. And as we know, there's increased risk of problem in the esophagus, as we see, because of obesity and so forth, and the aging population. So we want to diagnose this problem early and hopefully offer curative treatment for it.
Yeah, and a lot of what you do is spanned across 13 offices that you guys have, which is amazing. MidState Gastroenterology.
Yeah, so the way we do our practice, we try to triage this patient, we try to get them in a timely manner. I saw navigating the healthcare system sometimes be challenging for the patient. Going to the ER or calling primary care doctor or waiting 6 months for an appointment is not very helpful. So we're trying to work with to really make it a more patient-friendly, and we triage this patient. If it's something needs to be urgent, we can see them and get to the bottom of the problem, no puns intended, in a timely manner. So that's what we do at MidState GI.
And what I think is very timely about this is you were telling me that the age for screening for colon cancer has actually decreased because it's being found in younger people.
So that's we got to talk about. This will be the last part of the segment. Second segment, we're going to talk about if you have stomach pain. A lot of these people is like, every time I eat, I get stomach pain, which is sometimes, people are sensitive to certain food. But when you have a specific stomach pain in the upper area in the stomach, on the right side and deep in the abdomen, and it gets worse after a fatty meal, and especially if recurrent and getting worse, this could be a sign of a problem in your liver, pancreas, or the gallbladder. So it's something you have to monitor too. And the problem become more severe or worse, or more warning if you have a change in your urine, if the urine become dark or the stool become light. So this is something the patient have to see and monitor for that. And finally, to make your point, as we noticed over, I think the last, for a while now, for the last few years, that the incidence of colorectal cancer is happening in younger population. And that's why when you have a change in bowel habit or you have blood in the stool, you need to be checked. And that's why the screening colonoscopy now decreased from 50 to 45. Not to warn anybody, not to scare anybody in the lovely
but important to
full
know.
moon, but that's something you have to monitor it, and you have to check it, because every time people come to see me and say, I think it's hemorrhoid, my doctor told me not to worry about it, which probably true.
You always really bring us important information. Thank you so much. And we'll have those listed on our website, WTNH.com. People can also head to MidStateGastroCT.com.